Good morning, everyone. So what makes me less nervous is that I am one of the two transgender women in this room, I guess. Thank you so much. My name is, call me very shortly, call me Hua. So the title of my presentation today is Strength in Diversity, HIV PrEP product interest and preference among transgender women in 11 countries in Asia. A recent study found that trans women in Asia have 68 times higher odds of being infected with HIV, comparing with people 15 years and older in the general population. Providing a range of HIV PrEP products has the potential to close prevention, access gap, and expedite HIV epidemic control by addressing the diverse preferences and needs of key population who may benefit from PrEP. The PrEP appeal study aimed to determine transgender women preferences for different PrEP products in Asia, including a focus on long-acting injectable, cabotegravir PrEP, and pipeline products. The methodology of the surveys is the online anonymous cross-sectional surveys among transgender women across 11 countries or territories in Asia from May to November 2022. Participants was individual aged 18 years and above who self-identify as transgender women, and a separate survey was also conducted among men who have sex with men, which you already heard from Varita. The survey was also promoted online through the social media and website of community organization and partner in focus country. And this is I think this is a key to a successful target recruitment, as you can see in these two sample banners, in which we invite trans community leaders to take a part in promoting these surveys, and we also translate all the materials in the local languages. More than 11 languages has been translated for the survey material and the promotional materials. In addition, participants were asked about their interest in use and top preference among current and emerging PrEP products and dosing regimens, including daily orals, event-driven orals, long-acting orals, long-acting injections, and long-acting implants. Descriptive statistic and bivariant logistic regression were used to examine how participant preferences vary among PrEP experience versus naive respondent. On the other hand, we compare between experienced PrEP user and non-experienced PrEP user. Look in this table. So the average age of people who respond to this survey is 28. And we found that almost half of the survey respondents are PrEP experienced users, which could be because we have worked with community organizations in different countries to promote the surveys during its data collection. Of 11 countries, Nepal, Vietnam, Thailand, Myanmar, and India are the top 5 countries where we have highest survey responses. In the surveys, we asked participants to identify PrEP option they are interested in, and they can choose more than one. And 41%, almost 42%, expressed their interest in daily oral option. And PrEP experienced participants were 2.59 times were most likely to express interest in daily oral PrEP than those who have no experience. In addition, PrEP experienced participants were significantly less likely to express interest in monthly oral PrEP than those with no experience. Look at this. Look at the other question that we asked. We asked the participant that to identify only top PrEP preference. So what we found is that 1/3 of the participants prefer daily PrEP. We also found that more than 1/3 of the participants selected long-acting injecting PrEP and implants as their top choices. It's very important to note that there are demand of having more options to PrEP products in which they are not available yet in this region. Okay. All right, key message to take away from this presentation. Oral PrEP options were more preference than long-acting injection PrEP and implants among transgender women in Asia, with oral daily PrEP being the most preferred option. Despite limited prior exposure to long-acting injectable and implant, these options were preferred by more than 1/3 of participants, highlighting the need for a range of choices. Advocacy is needed to make long-acting PrEP option available as a choice in person center, differentiate PrEP services for transgender women. And lastly, I just want to put on my human rights advocate hat here. It's very important to also note that while we are so excited of the result of this survey, returning this important data back to the community will make meaningful contribution. And despite of many setbacks transgender experience recently across the world, especially in Africa, in America, and elsewhere in the world, we do need to invest in trans-led organization. Not only they can understand trans people experience, but also they can engage in the dialogues on HIV prevention and healthy lifestyles. And lastly, I think I should address a few of my colleagues here who contribute in the successful surveys, including UNAIDS, WHO, FHI 360, PATH, APACC, APTN, and AHI. And last but not least, are the community members who engage in the survey promotion and who help promote this survey throughout their own community. And if you want to learn more, I would encourage you to go take a look up the poster number 86. There's so many information that I haven't said in this presentation, but I would encourage you to read through that poster, number 86. Keep that in mind. Thank you very much.